Hi, my name is Amber Hodge. We're continuing on with the third part of our health assessment exam today with Mr. Johnson. I'm going to pick up where we left off, and that is auscultating Mr. Johnson's lungs. Take a deep breath for me, and just exhale and breathe normal. Keep breathing normal. And at this point, you could have the patient say E, and you would listen to see if that sounded like an A sound. And if that did, then you could basically that would indicate some type of fluid buildup or pleural effusion, consolidation, or something like that that you would want to look further into. So basically, like I said, we're all done with this posterior thigh examination, and just noting in general, you would want to note any spinal abnormalities, how prominent his spine and ribs are. You would want to note any nodules, inconsistencies, or skin irritations, anything on the back side of his body also. So I'm going to have Mr. Johnson go ahead and lay down now, and I'm going to reposition the camera here a little so you can see his abdominal examination here. Okay. So moving on here now, we're going to further assess his lungs. We're going to listen to his anterior lobes here, also comparing size for breath sounds, qualities, and any extra breath sounds like we said earlier. Perfect. Perfect. And at this point, you could have the patient go ahead, you can listen to his vowel sounds. You can get everything done now that you're listening for, which we would go ahead and do that. Finish up listening to his long. And then now in his second intercostal space on his right costal margin, you would want to go ahead and you could listen to for his heart sounds now. And over to his left midclavicular second border region. You're just listening for any extra heart sounds. And now we're going to go ahead and go down to Erb's point. Moving down to the fourth intercostal space on the left side of the chest. Midclavicular, you're also listening for his heart sound here. And now at his fifth intercostal space, you would look for his apical pulse, which is also his point of maximal impulse. And you could also just at this point feel his apical pulse, feeling for any thrills, any heaves, extra pulsations, anything at all. You would want to just take your time listening to each and every point on his chest, assessing for any extra murmurs. If you were to hear a murmur, you would just simply want to note his location and intensity of it, and that's how you would basically document it. So now at this point, you can go ahead and listen to his carotid arteries and move on to his aorta, his renal, iliac, and femoral arteries, and you can go ahead and listen to those for any bruits as well. So ideally, the higher pitch is used with the diaphragm. You would use your bell of the stethoscope to use the lower pitches. So if you did hear something abnormal with his cardiac exam, you would go back and listen with the bell, and you would better hear the lower pitches with the bell of the stethoscope. So at this point, I'm going to ask Mr. Johnson to turn his head towards the right, and I'm going to listen to his carotid arteries. Sounds good. And once again, noting any thrills, heaves, or extra pulsations. You could go ahead and just listen to his heart one more time with the bellow stethoscope. And once again, then you're going to go ahead and move down to his aorta, which is kind of right underneath his xiphoid process here. At the same time, you can go ahead and listen to his vowel sounds in all four quadrants, which is iliac, and his renal, and then you can listen to his femoral. Now at this point, to finish up his abdominal exam, actually you can place your stethoscope on the kind of right upper quadrant area where you think you should be palpating the liver, and you can actually bring your finger up, dragging it across his abdomen, and you'll hear a scratching sensation whenever you get over the liver, and that will let you know where the bottom side of his liver is to palpate. Indirect percussion now, you would want to go ahead and you could percuss. Once again, you could palpate his kidneys, ask him if that hurts at all, which does that hurt at all. Going back to the liver now, you can go ahead and palpate. And this is indirect percussion, noting basically the difference of the sound. Over his GI tract, you basically should hear more of a timpani sound, and that's basically because you're over air. Once you move over an organ or fluid mass or just solid mass, you'll hear more of dull sound. So you can go ahead and do that, and you can mark up where you hear the difference in the sound, and just kind of note where you hear that. Moving downward, starting up here, you would also want to go ahead and do the same thing, percussing over his lung area and going down to where his liver should be and his spleen border should be. And you'll basically note the difference of sounds, and you can also estimate size of his liver. If it's more than 2/3 inch to the left or something, you would want to basically assess for any extra or any liver enlargement or anything like that. So basically at this point, we've assessed his abdomen, we've assessed his heart, we've looked at his skin, we've done all that throughout this whole exam. We've been assessing all his cranial nerves through his visual acuity, his sound. You could also further examine his cranial nerves by asking him to smell something. At this point, though, we can go ahead and ask him to sit up, please. And I will finish out my neurological exam here. And basically, you can ask him to distinguish differences in temperatures and tell me if this is cold. Yep. And cold. Is it cold? Yes. And is this cold? Yes. Is this cold? Yes. Okay. And then is this soft? Mm-hmm. Is this soft? Is this soft? Yes. Is this soft? Yes. Perfect. And that basically would conclude, we would have already by now picked up if he was having a neurological deficit by assessing his speech, his eye exam, and all of that. So now we're going to go ahead and move on to his musculoskeletal system, which will conclude our examination. So at this point, we're going to go ahead and do passive range of motion of the neck, and I'm going to have you turn your neck to all 4 directions. So you're going to go ahead, turn your neck side to side, and other side, and flex it forward, and extend it back. Perfect. You're going to repeat all those same steps by applying a little bit of resistance as he leans in towards my head. Put a little resistance towards it. Perfect. And other side. Perfect. And lean forward for me. Perfect. And extend your head. And perfect. And go ahead and squeeze my hands as hard as you can. Squeeze my fingers. Squeeze. Perfect. And also noting the symmetry in hand grips, the strength of his hand grips, and seeing if there's anything going on unilaterally. At this point, you can go ahead and have him do the same thing by having him do the push-pull for his feet. And you're going to go ahead and push against my hands. Push, push, push. And lift your toes up towards me. Perfect. And if you can go ahead and extend your leg here for me as I'm going to push down. Perfect. And lift your knee up. Perfect. That basically would assess our muscle strength and assess all the major muscle groups that are necessary for walking. So at this point, if any of those were abnormal, we would want to look further into that. Hi, my name is Amber Hodge, finishing up with Mr. Johnson. We're basically concluded with our examination, except for at this point, we would have wanted to test Mr. Johnson's reflexes. So at this point, we could have done that with um, testing his reflexes by simply having his arm placed on yours. You could test his brachial inflex or reflex, and then you could test his brachial radial nerve here by simply tapping on it and noting his flicker of his arm. You would go ahead and you would tap his patella and notice the little kick in his foot. Moving inside the heel, you could tap his Achilles tendon, and that would basically assess his Achilles reflex. And that basically summarizes our head to toe examination. Thank you, Mr. Johnson, for participating and letting me record it again. I appreciate it. And that's